Parkland Emergency Services for what town or city?
My name is Brenda Dechak and I am the Operations Manager for Parkland Communications Center.
And the patient's last name?
There's some days where they can process 60 calls in a 12-hour period and then go into the night shift and do another 40. I don't know if you just heard that sigh, but yes, it can be a very stressful job at times. We dispatch for 14 ambulance companies, so we basically do all the north. So just trying to imagine dispatching for, 12, 14 ambulances all out at the same time. And there could be up to 6 ambulances out for each service. So it can be very hectic. The good thing to always have when you live in a rural area, have by your phone is your land location and a set of directions from Prince Albert or Spiritwood or Blaine Lake or wherever. But it's really important because if you can give us the best way to get there, and it's easy to find, the directions are easy to follow, the ambulance gets there much quicker.
Hi, I'm Kelly Straff. I've been a paramedic for 20 years. Being a paramedic is a really valuable and rewarding career. We see a lot of people every day, day in and day out, in a lot of different situations, whether it be good or bad. And it gives us the opportunity to make a difference in a lot of those people's lives and help them out every day. Essentially, we bring the emergency room directly to your doorstep. So as far as our advanced care paramedics go and the resources that we do carry in our ambulances now, you'll get the same treatment in the first 10, 15, 20 minutes in the back of an ambulance or at your doorstep in your living room that you would get from a physician right in the ER. It can be emotionally stressful, it can be physically stressful, depending on the day and depending how busy it is, and what you're dealing with. Like day in and day out, it can be, for some people, they may see a string of bad events that really tax on them. And for some, you may have a string of really good events where you help people and make things better. You might deliver a baby, you might help somebody to feel better or get them back on track. I mean, paramedics have to be strong people and they have to have good support and a good safety net along with them. So everybody has their own way of dealing with their stress and different things, whether it be you go for a round of golf or you go and visit with your friends or your family. It's Paramedic Services Week. Our theme this year is expanding care and changing lives. So basically what that means is paramedics not only are bringing frontline healthcare out into the community, pre-hospitally before the ER. What we're doing now is expanding that role along with the police services you'll see in town with tactical EMS paramedics that are training along with the SWAT team. And providing them with medical care and or people that they're dealing with. Also nursing homes and into the public community paramedicine is what it's called, and we're doing lots and lots of that now. You're seeing that throughout the country and throughout the province is an expanding role for paramedics there too, where they're doing home care things that are valuable to the people in the community and the patients in the health region as well. So some of those roles you're going to see paramedics expanding into more and more each day, are helping patients in our health region all the time. You're never really doing the same thing twice. So definitely rewarding in that aspect. Always keeps it interesting, and we have a great team. So that being very important, all the people you're working with to keep you on your toes, to help with training, to keep you laughing, and it's nice to have such a great team to support all of that.